Despite the side effects, there is unprecedented demand for drugs like Ozempic and Wegovy.
The FDA just approved Wegovy to be marketed for heart benefits as well. Now, there's a lot to talk about. UW Health's Dr. Jeff Pothof is here. Welcome back.
Hi, Dr. Pothof.
Hey guys, welcome.
So yeah, first of all, I mean, this is something that a lot of people are trying. We've seen a lot of celebrities and a lot of wealthier people try it. But is it feasible for someone with regular income to go for it? Because it's very expensive.
Yeah, I mean, it's hard right now because a lot of these medications aren't well covered by insurance companies. So if you're paying out of pocket, you could be looking at thousands to thousands of dollars per month for these medicines. They can be effective though. So certainly if you're considering or you're wondering about it, not bad to have a discussion with your primary care provider, particularly if you have diabetes type 2 that you're having difficulty controlling with, say, metformin or other medications, or if you're obese or overweight, defined by your BMI, and you're having trouble with managing that, there could be some indications there. But right now they are still relatively unaffordable for most people.
And they're not primarily just for people with diabetes? In other words, they can be prescribed solely for weight loss?
Yeah, so and it really depends how the manufacturer gets FDA approval, but these medications there's really two use cases right now. Better management of diabetes, so blood sugar control, and weight loss. For example, Ozempic and Wegovy are the exact same medication, just licensed for different uses.
So how does this work? How does it trigger the weight loss?
Yeah, so these medications are called GLP-1 agonists, so glucagon-like peptide, and they have a few effects. So one, they stimulate the pancreas to secrete more insulin. Insulin kind of eats up your blood sugar and then drops your blood sugar. And then they also serve to make your transit of food through the GI system slower. You know, if I eat something, it stays in my stomach longer, and that makes me feel more full, like I don't need to eat anymore because I'm full, and that can persist. Eating up that sugar and then also making it feel like you're full is what drives both the decreased blood sugar, which is what we want in diabetes, and the weight gain, which is what we want in people with obesity.
And is it a long-term treatment?
Yeah, typically. So you typically inject it. Most of these are injectables underneath the skin. You take it once per week, and you stay on it for a long time. These are all relatively new, so the full kind of like how long do you need to be on it isn't understood, but it's likely that you'll need to be on these medications for the long term. And good to point out, they're not miracle drugs. So if you just take the medication and be like, all right, I'm going to lose a lot of weight, doesn't work that way. It still takes attention to diet and exercise, but when you combine those things with these medications, it can be pretty effective.
Do you think that this will have the Oprah effect and we'll see more of a demand for it now?
I think you could, although demand probably can't be that much higher than what it already is for these medications. I think it's good for consumers to have awareness, though, that these things are out there, and talk with your doctors, if for anything, to just like drive more attention towards diabetes and why it's so important to control blood sugars, and weight loss, and why it can really make a big difference in your health long term if you're able to manage weight.
Definitely something to talk to your doctor about. Thanks, Dr. Pothof. Very interesting.
Thank you.
Good to see you.